You are listening to Wellness Prescribed with Fisher-Titus Medical Center. And we are here once again for Fisher-Titus Wellness Prescribed, talking with Dr. Christina Canfield about Medicare and the annual wellness visit. So thank you so much for coming in today.
Well, thank you very much. I'm glad for the opportunity to talk about something I'm very passionate about.
Okay, so what exactly is the Medicare Annual Wellness Visit?
So it's a visit done in your primary care office by your primary care team once a year for Medicare patients that focuses on wellness and prevention, just that.
Okay, so how is that different than a physical exam?
Or a regular visit?
Yeah.
Yes. So it's a Medicare Annual Wellness Visit, and it doesn't include a physical exam. It's just the components that are prescribed by Medicare for the annual wellness visit, and it also addresses a lot of other things such as prevention, wellness, immunizations, level of functioning. There's lots of stuff that it goes over.
So those are the main components then that go into it?
Yes, you review and reconcile all medications, a list of your medical problems and all the specialists the patient will see, and get updated reports from those specialists. There's a series of questions and screenings that evaluate your current health, your level of functioning, includes mental, physical, emotional, and then that compares you from year to year. It reviews all the needed prevention and screening tests that you need based on your unique risk factors, and it updates, like I said, immunizations and advanced directives. Just lots of components. Yeah.
So are there any specific screenings then that go into that, or is that just based off of your own personal?
It's in part based off your own personal risk factors, but also, everyone needs screening as far as for women, screening mammograms. Everyone needs colon cancer screening, so that's addressed. Men might need a prostate cancer screening based on their risk factors, blood test screening for sugar and for cholesterol. If you smoke, for lung cancer, so there's lots of screenings.
So lots of things that go into the annual wellness visit. So this is more about prevention and more so than anything else then.
Absolutely. And why it's a unique visit is because I, as a physician, when I see you for your routine checkups for your health problems, can you imagine me trying to fit all of that
right.
in to a visit? So that's why one visit dedicated to these things is very much needed every year. I know patients balk at that. Why do I have to come in for this? It's because I want to be able to focus that time on those issues versus the time when you're here for your hypertension or diabetes,
Sure.
because it takes a lot of my time to do that.
So for scheduling purposes, you know how much time you're going to need to allow for a visit like this rather than just a regular screening
Absolutely.
for your yearly physical checkup.
Yes, absolutely.
All right. So then if somebody's going to schedule this, then what do they need to know before that first Medicare Annual Wellness Visit?
Well, the visit's going to take about an hour or so, hour and a half. They should definitely bring all of their meds and all the supplements that they take, including insulin inhalers, or a very thorough list of them. They should bring a list of all of the specialists they see with some contact information so that we can make sure we incorporate that in the chart. And also any questions that they have, a copy of what advanced directives they have, or any questions they have about advanced directives, which would be like living wills, power of attorneys, that sorts of things.
Wow. Okay. So how can anybody schedule this visit, or is it specific to Medicare recipients?
You have to be a Medicare recipient, but most people think of Medicare as people over 65, but there are a great number of people who are on Medicare earlier because of disabilities or whatever. So it's anybody who's on Medicare regardless of age, and that could include straight Medicare, Medicare secondary, or what we call Advantage plans or managed Medicare plans.
So then how does the billing work for that with the Medicare?
This is a free visit.
Okay.
Okay. If you're just doing the Medicare wellness visit, that is absolutely covered entirely by Medicare because they realize the value of this for their population.
So then what follow-up actions are recommended then after this visit? Maybe you're finding some things with these screenings and that. So what kind of happens after that?
So the Medicare wellness nurse or population health nurse that does them in our organization will schedule, labs if they haven't been done. She'll schedule the screening tests like mammogram, colon cancer referral screening, lung cancer screening. So all of those tests need to be followed up on. And then you'll be visiting your physician or your primary care provider, whether that's a nurse practitioner, PA, physician, to then go over those screening tests. if there's any problems. Sometimes because all of our population health nurses are she's, will find something abnormal during the wellness visit. Say your cognitive screen was abnormal. So then they would schedule a follow-up with your primary care provider to talk about anything that's abnormal found during that exam.
All right. So Fisher-Titus.org is the website for Fisher-Titus Medical Center. So talking about the Medicare Annual Wellness Visit, open to all Medicare recipients, regardless of age, like you said. So
absolutely,
very important to get this message out. I don't have Medicare, so I don't know, but this seems like something that hopefully other providers will get on board with. It's just incredible that there's something like this.
Absolutely, and let me just say, just because if you're not Medicare, you still should be having annual wellness
well,
visits.
As
kids or young adults, you should still have Medicare.
This is just Medicare specific today that we're talking about these ones. So contact your providers, Fisher-Titus.org to get more information. Christina Canfield, thank you so much.
You're welcome.
For coming in once again to talk with us about this. You've been listening to Wellness Prescribed with Fisher-Titus Medical Center.